Hi, I'm Dr. Lisa Strickland with Spine Wellness Center. I've been in practice since 2004. Been practicing NUCA, and then we've incorporated the DRX 9000 in our practice. It's a non-surgical spinal decompression. We've seen patients from all over the valley between chronic neck pain, headaches, neck pain that just started, say, on Tuesday, and they're here on Thursday. But people with burning pain, tingling, numbness. We've had people with numbness in their feet, and if we do an evaluation to see are they a candidate for just the chiropractic in, or are they a candidate for the non-surgical spinal decompression. We do an evaluation, we'll take x-rays, we'll do some tests. If we decide that we need to do further testing with an MRI, we will order that up. I wanted to talk to you a little bit about why a patient would be looking for cervical decompression. Many people come in with chronic neck pain. Chronic meaning it's been going on for a long time, where there's been an injury of some sort, where they're having stiffness, achiness, burning, numbness, and tingling pain down their arms. Everyone's a little bit different on what their symptoms are. We do an evaluation, a postural evaluation, some exam, but also we're going to look at x-rays, and if need be, we'll do MRIs, order MRIs too. But over here, this is a particular patient. One of the things we're looking at is the curvature in their neck. They don't really have much of a curvature. It's very straight. But that in between each set of vertebrae here, there's a disc. That's the disc that people talk about, that it's herniated, bulging. But as we get down between C5 and C6, we can see the difference. See how much thinner that is? It's very thin, whereas C6, C7, we have space again. C4, C5, we have space. That is someone that needed cervical decompression.
Dr. Sperry here. We want to take a second and show you what cervical decompression looks like. And this is an example of someone set up for cervical decompression. The knees and the legs are supported. That helps with the lower back. And then you will see that it actually looks like nothing is happening here. It's very, there's no absolute twisting or pulling, anything like that. But Brittany, how does that feel to you?
It's very gentle, relaxing.
What if some patients told you they feel it after or during?
A lot of patients, if they've had headaches, they're greatly improved. It's, I know if they have tingling or numbness in their arms, that's improved.
Awesome. Great. Awesome. So one of the main reasons people do choose cervical decompression is a specific herniation of the disc in the cervical spine or in the neck area. So we're able to actually isolate those levels of the disc and herniation based on the angles we use, and also based on how much load factor and how much decompression that we are using at that